Hello, everyone. Welcome to our Circles webinar. Today, we're going to be telling you about this NHLBI funded project. The aim was to support COPD care in the rural United States. You can see here that the Circles acronym stands for Clinicians Improving the Rural COPD Landscape Through Education and Self-Care. And in the next 30 minutes, you're going to learn more about the project and our findings. So we're excited that you're here. Thank you for joining us. Let's go to the next slide. So my name is Kristen Willard. I oversee educational initiatives for the COPD Foundation, and I am joined by Stephanie Williams, who is one of our fantastic respiratory therapists on staff, and she was one of the primary leads on this project. We would also, of course, like to thank people who you won't see here today, but that were behind the scenes. Dr. Barbara Yawn, who was one of the PIs, and also Brett Denning, who is on the foundation staff. They contributed a great deal to making this project happen. And I can't see the slide moving, but let's go to the next slide. Are you able to see them advancing, Steph? Oh, there we go. Let's
I
go to the
am now.
next.
Thank you. Thank you for
Okay,
mentioning that.
let's go to the next one. For some reason, they weren't moving, but that's okay. They don't need to see our pictures. Let's get to the real info, right? Um, let's talk a little bit about why we wanted to do this project, right? Why was this important to do? Well, you can see a lot of important information on this slide. More than 3.5 million Americans living in rural areas of the U.S. specifically have COPD, and we know that up to 1 million more may have the disease and not know it. An interesting stat here in the second bullet. Rates of COPD are higher in rural areas, and you can see significantly higher, 8.2% to 4.7%. I mean, nearly double compared to the urban areas. I mean, that's really substantial. So we know that a COPD is a plague for people in rural areas, and that they're facing challenges that people may not in other locations. So let's look at this blue box below that. We know that residents of rural America face additional health challenges like limited access to care and fewer medical specialists. So the first two, I think, really go together. There are fewer specialists living in the rural US to see people with COPD, and people with COPD sometimes live very far, right, from their nearest primary care doctor and even farther from a specialist. We also see socioeconomic disparities, right? And we'll talk more about that. We know resources are not equal between those living in rural America to those living in or closer to the city. And there are different environmental concerns that people with COPD in rural America face. So sometimes they could be related to workplace concerns, as you likely know, whether it's pollution or chemicals, and also just related, of course, to ambient air. So whether that's in the home or outside, things such as using wood burning stoves. And I really love this fact that's included over here on the right. The 3.5 million people that I mentioned in that first bullet, that's the equivalent of the population of Chicago, Illinois, right, and San Francisco combined. It's almost unfathomable. So it sort of gives you just an idea of the scale. Here's an example of one of the disparities we talked about before. 97.5% of people in urban areas have a pulmonologist, within 10 miles of their home, compared to just 34.5% of people in rural locations. So you can really see, as an example, right, a stark example of those disparities that we highlighted in the blue box on the left. So let's go on to the next slide. Well, let me tell you a little bit about what the project entailed. As I said, really the aim was to address these gaps in care for people living in rural areas who had COPD. One of the main things that we focused on was improving patient and provider communication on a variety of different elements, and also COPD self-management. We want to support patients to care for themselves at home and for them to feel comfortable talking with their healthcare providers about what they're doing at home to keep themselves healthy. To that end, we conducted surveys and focus groups, and you will hear more about that in the next few slides. And these were done with patients with COPD as well as with clinicians. We also created a toolkit for patients with COPD to help with self-management. So the whole outcome of this work was this toolkit, and you're going to hear more about that. Stephanie gets the very fun task of telling you more about this fantastic toolkit that we created. It's quite comprehensive. We tried to make it engaging and fun as well, but this is really the end product that we wanted to offer people working in rural America and living there as well. Part of what that is providing busy healthcare professionals, specifically those in primary care, but sometimes outside of that, with these tools because they're so busy. Oftentimes, we know you can't create things yourselves, right? Your resources are challenged, especially time wise. And now we can offer this to you via our website to share with your patients. And lastly, we recruited volunteers that would test the toolkit and give us feedback. And that's also something you'll hear about in the later part of this presentation. So we're really pleased to bring this to you. So let's go to the next slide. That's some background. Now, those surveys and the focus groups that we did at the beginning, this was to give us an idea of what the landscape looked like, hear what people's needs were with respect to tools, what they used, a variety of questions. Those were conducted early on. Uh, for the surveys, 116 patients with COPD and 50 healthcare professionals completed the surveys. We then recruited participants for the focus groups from the people who the pool, excuse me, of people who completed the surveys. And so we had two focus groups, one with patients with COPD and one with healthcare professionals. We tried to make that HCP group as diverse as possible because, of course, we want as many perspectives as possible. So the HCP group included a respiratory care supervisor, as you can see here, two RTs, a nurse, and one NP. Let's go on to the next slide. Fantastic. So many social determinants of health created barriers to accessing care and using self-management tools, as you can see here. So we're talking about those things in our environment, right, that affects things like our health, the quality of our lives. In this case, we heard from people with COPD that the things here impacted their ability to have better health and care for themselves at home. So for the first of these, low income and poverty was a significant barrier to people living the healthy life that they wanted to. And related to that, low educational attainment. We're talking about more minimal or a lower level of education. Inadequate infrastructure, which we can all appreciate. You can imagine that having limited access to high quality Wi-Fi, particularly during COVID, would be an incredible barrier, given that so much of the work that's being done with patients right now is done via portals, via telehealth. So you can imagine the Wi-Fi, other things such as access to public transportation. I bet everyone on the phone is nodding their head right now, saying, yes, we can appreciate that. That's even the case in suburban and urban areas, but is a particular problem in rural America. Let's go on to the next slide. So the basis of the project, the tool that initially we really wanted people to use, right, was the COPD Pocket Consultant Guide app. So to tell you a little bit more about the app, it is free. You can download it from Google Play or from the App Store just by typing COPD Foundation app or COPD Pocket Consultant Guide. One side of the app is for healthcare professionals. The other side is for patients and caregivers. What we wanted people to do was to work within the app to maximize their self-management. So on the provider side, there's information about videos, excuse me, for nebulizers and inhalers. We have information on medications, all manner of things like the MMRC and CAT that can help to track breathlessness and how people are doing in general with their COPD. So that's a fantastic resource that's out there, but we wanted to get that in the hands of primary care. On the patient side, which you see a snapshot of here, there's so many features that we want to get in the hands of people living with COPD to help them manage their disease, to help them to better communicate with you, their healthcare professionals. I'll tell you a little bit about a few of them. The daily log really captures those things, their activities on a daily basis, right? So they can put in how things are going for them achieving certain activities, what things are more difficult. And these actually track to a calendar so that it's saved, so you can track patterns. And we have an action plan that does the same thing. It's part of that calendar. So I think most of you are probably familiar with that. It employs a stoplight model. I'm doing great on a green day. I'm in trouble on a yellow day, and red, I'm in serious trouble and I need to take action to get emergency help. So when they fill out that action plan, the results of that are also stored in the calendar. We also have a section called For My Next Visit, which we designed to really support that communication that happens between clinicians and their patients at visits. And there are common questions here that patients can just click off so they have it ready for the next visit. There are things that places they can add questions that they have for their healthcare team. So this is something we wanted to offer to them, as well as those inhaler and nebulizer videos and a lot more that you can see if you go into the app. We hope you find that helpful. So this sort of formed the basis of this project, and we wanted people to use this as well as the other tools you're going to hear about and tell us how helpful they were or what changes needed to be made. But let's start with the app specifically. Let's go to the next slide. The feedback that we heard from people when we did these focus groups from the impacted individuals, we heard they said, we don't think that we're likely to use this app on a daily basis. We might use it less frequently. We might find it helpful, but maybe not every day, which is good information to know. People in our focus groups told us that they don't always carry the phone with them, right? They don't always have it on them in order to track information, which is also very helpful to know. And we heard loud and clear that people would also prefer a low tech option, right? Could there be something that would help us in our self management that wouldn't come in the form of a smartphone, because many of us don't rely on them to the extent that people might think? And from the healthcare professionals, we also heard these types of things, doubts about whether patients would use the app, whether that's something that they would even find helpful. Healthcare professionals also thought, though, that there could be a possibility of using these in face-to-face sessions. So an example would be someone has a new inhaler, they're in your office, they don't know how to use it, you want to practice, right? You show them in the app exactly where this is located, so we'll do it together now, right? And then you'll have this when you go home. Or let me show you how to use this action plan and walk through it and track your symptoms over time. So they thought that that might be a good use of the app. And you'll hear again more about this, but based on these findings, we're in the second phase of this work going to be developing a low-tech option for people without access to smartphones. Because as many of us rely on this, as much as many of us have these in our hands all the time, we found that that was not the case for the people we spoke to. Okay, let's go to the next slide. So we also asked them, what would really help with COPD self-management? I think these findings are fascinating. So patients said to us, teach me how to avoid flare-ups. I need to know how to stay out of the hospital and avoid exacerbations. They wanted a way to track symptoms. Also important, right? So a way to keep a diary of what they were experiencing many times so they could see it, and also so they could report to their healthcare professionals. They're also interested in how-to videos. Make sure you're showing me how to use things correctly, my nebulizer, my inhaler. And also they were interested in my COPD action plan, as I described to you just before. Healthcare professionals told us that they were interested in a patient appropriate explanation of the disease process, right? How can I show my patients or explain to them very clearly what is happening with their lungs? Information on what patients can expect, you see here in the second bullet. So, what's next in their treatment plan, etc. Uh, action plan showed up here too. So that was very interesting to us that this was on both of the healthcare professional and patient list of priorities of what would help with COPD self-management. Videos and on device management, again, something else that showed up on both. And then this last one is interesting, advice on quitting smoking. So this was a top idea from our clinicians, but it was the lowest choice from the people we spoke to who had COPD. So that's an interesting difference for sure, that the importance that the two groups placed on that was different. So let's go to the next slide. Moving forward, Stephanie is going to tell you all about the toolkit and then feedback we got from people who actually used it in the field. So I'll turn it over to you.
Great, thank you. I am really excited to be with you today to share a little bit about the toolkit and the materials that we provided for this study. This is one of those things that was so exciting in the development phase of it. And so I hope to be able to convey some of that excitement to you all here today. But as Kristen was mentioning earlier, there were a few tools that we wanted to provide in that low-tech kind of way, and that, for the patients to have hard copies of. One of those was the My COPD Action Plan, the stoplight, green, yellow, and red that we're familiar with. And then we also provided them a hard copy, like a printed out version of our report exacerbations worksheet. So they had those with them along with this game board that you see here on the right side of your screen, the larger image. So we developed this as a way, as a tool to help guide people in how to use the app. So at the very beginning stages of the development of these tools, we were thinking about the app, and I started thinking about my own personal app usage and thinking, okay, I've got maybe 50 or 60 apps on my phone, and I don't use any of them fully. I don't use every single feature of any of those apps. I use them what I use them for, and that's it. So I don't really go in and dig in or even explore. But we wanted to encourage people to do that with the PCG app because it just has so many different things in there that can really be beneficial to them in their everyday life. I mean, actual applications into their everyday life. And so the first thing we did, we wanted to back way up. We wanted to back way up to the beginning of why is someone even interested in education about COPD? And so they, bottom line is, if someone comes and they are curious about, education, that means they want to improve something. They want to improve a certain part of their life or how they engage. So we wanted to start in that dark orange section at the top of the game piece there. We start with their goals. And as a respiratory therapist, and I've, did rehab for years and did bedside care for years and home health, we start with goals because everyone's goals are different. Now, my goals as a therapist would be, I want to improve the quality of life for this patient as much as I can, but what does that look like for them? And so we just wanted to start at the beginning and have the individual list the goals that they have for themselves as it relates to COPD. We even provided a link there for a little video on goal setting if someone wasn't sure what that meant or what that looked like. So we tried to give them guides along the way, even for setting their goals. And so each of these little bubbles out from this circle kind of represent a different section on the Pocket Consultant Guide app that you see there pictured also. So we wanted to create a way, and it's in this circular format, so that it indicates to them this is something that they can continue over and over. So just because they go through the section on medication management or exercise and activity, it's not like it's one and done, check, and that's off my list. They can continue to revisit these things as they need to, or as they might need to refresh their memories. So going from that start in the dark orange, it went counterclockwise down to the medication management, where they were instructed then to fill in the wallet card section of the app. So this dark blue corresponded a little bit with the wallet card section on the screen. They could actually go in and list all of the medications, not just their respiratory medications, but all of their medications, all of their vaccinations, their tests. If they have CPAP or BiPAP settings, they can list those there. It's just a one-stop place to house everything, all of their information. The other thing that is really something that is important to patients is that we don't have a way or even a desire to, backwards engineer this and log in and try to see what people are putting into their system. Once this is downloaded into their phone or onto their tablet, this is a safe place for them to keep that information. We don't have access to it. No one has access to it. It's safe on their device. So that's an important point. Along with each of these little bubbles, where it gives them instructions on how to move through medication management, which, what breathing medicines do you take? Do you know when to take them? It instructs them to watch the videos for each of those respiratory medications, whether it be inhaler or a nebulizer form. So these videos, especially the nebulizer videos, have two components to them. It's not just how to use them, which is important because there are many different kinds of nebulizers out there, but also how to clean them and store them between each use. And so it gives them a chance also to practice how they take their medications and make sure that they're doing this in a correct way. Because I think over time, all of us begin to get a little bit of, what's that term? It's slippage, so that we're not doing things exactly right. We kind of develop our own way to do it. And we know that with medication delivery, the technique is important. So that's why we spent some time on that. Again, for each of these bubbles, we had a video that went along with each of those sections. And Dr. Yan narrated those and instructed the patient in how to use each of these sections and what they were really designed for. We did this so that we have something for each style of learner. So we might have people who really just want to dig in and read the material, do it themselves, or we might have people who want to be shown and instructed. So we have something for everyone here, for all types of learners. But this went through the different components of the Pocket Consultant Guide and was really helpful in guiding them through how to use these sections and how they impact them in their daily life. So some of the feedback that we got after people had had a chance to use the toolkit and use the game board and use the app and use the videos, that the healthcare professionals that responded to us said that the toolkit was really helpful and that the videos that we provided with the instruction were very important in emphasizing the important points that they try to also convey in their clinics. They said that the game board was easy to use and it was informative, and that the PCG app was certainly a powerful tool that patients could benefit from over time. And that the patients that they shared the app with, they were very receptive in being able to use something like this on their own to promote their own communication between them and their healthcare professional. So those who are living with COPD gave us some feedback as well after they had some time to kind of play around with the app some and dig in and figure out where all the buttons were and what they all did. Those who participated said that they found the project to be beneficial and thought that it would be useful for others who are in similar circumstance. This was something that I thought was important to share with this group in particular. For individuals who show fewer symptoms, who may be at an earlier stage, they don't necessarily see COPD affecting them much, and they don't instinctively understand this need for education. So going back to a point that Kristen made earlier, as the healthcare professionals had indicated, it's important for us to have a patient-friendly way to describe COPD and disease progression and what happens next, understanding this disease progression, even at a high level, is very valuable information for the patient and caregivers so that they understand the importance of that education that we're trying to help them achieve. So overall, the toolkit was filled with helpful information. They said the game board was a fun and easy way to keep track of what they were doing and what they were learning. But they really appreciated having that hard copy of the MyCOPD action plan to accompany the app. They all thought that was a really good idea. So some of the other feedback that we got from the patients is that it was a little bit challenging sometimes to navigate the app, but once they were in and practiced it a little bit, they found that it was easier to navigate and they were able to use it. Most of them said that they would like to have had a little bit more one-on-one instruction on how to use the app, and they liked the features about activity tracking and the ability to monitor symptoms and record daily symptoms. But some of the feedback that we even got, they would love to see something even more customizable. We were showing them, like on the For My Next Visit section, where they could go in and actually select questions that they would like to make sure they ask of their practitioner at their next visit, and they can even create their own question to be added to that list. But in addition to that, other people were saying they would love to see things that were a little bit more customizable for their needs. One challenge that we encountered during this project, because again, this was intended for rural communities, one challenge that we encountered was that many of the impacted individuals either didn't have smartphones or tablets, or if they did have smartphones and tablets, they just didn't use apps. So those were a couple of the challenges that we encountered throughout the course of this project. So our lessons learned. We learned that there's a lot of work being done in the space to help people who are living in rural America, but there are still lots of challenges that remain. And Kristen had alluded to those at the beginning of the presentation, whether that be the social determinants of health and socioeconomics, education, proximity to care. There's still lots of those challenges that remain. And COVID-19 created significant challenges to our project being implemented. So what we found was that telehealth often occurred without video. It was mostly just phone conversations that were being had over the, just throughout the course of someone's care. But this made recruitment for this project a little bit challenging. And then additionally, because this project was designed for primary care use to assist the primary care providers, they're already pressed for time. So they found it a little bit challenging to devote time to this project. But we think it's very important to continue that focus on primary care, or at least in that space, because we understand that a lot of care that's given in rural America is done by primary care. Again, with that lack of access to specialists in particular, or the distance that people have to travel in order to see a specialist, we understand that a lot of this care is being done at the primary care level. And there is a gap in how impacted individuals and HCPs perceive their ability to use technology. So going back to one of the things Kristen said was, the healthcare professional said, I don't think my patients are going to want to use technology. And what the patients were saying is, oh, we will. We just need to understand how that helps us. And so that little bit of a gap, if we can help to bridge that gap, we can maybe overcome a few more challenges for rural health. As we wrap up, we would like to acknowledge people that helped us and supported our project. We appreciate and thank NHLBI and WestStat for their support of the project and team. We would also like to thank the following: the Rural Health Medical Education Collaborative at the Division of Talon Health, as well as the healthcare center partners that we had in New Mexico and Colorado, and the members of the CIRCLIS Advisory Board. We really could not have done all of this work without you all, and we appreciate you so much. We appreciate your time here today. We are going to conclude with this last slide. If you have any questions that you would like to ask of the team, we ask that you will send those over to us in email form. Send those to info@copdfoundation.org, and we will respond to those as soon as we can. We appreciate your time and your joining us today. Thank you so much. Have a great day.